One of Idaho's most exhausted healthcare systems made a call for help. And now, 3 large Idaho health districts are under crisis standards of care again. Our Andrew Bartline followed Health and Welfare's COVID media briefing today. Andrew, give us a better look at the staffing and blood shortages taxing Idaho hospitals. You told us about this yesterday. You said you were going to catch up with health officials today.
Yeah, we heard from Saint Als, who requested to go into crisis standards of care. They say they aren't rationing care yet, but these shortages that you mentioned are making it difficult inside their hospitals. And the concern isn't what's happening today. The concern is what could potentially happen tomorrow, as Saint Alphonsus doesn't expect these problems to be resolved anytime soon. A candid panel at the Health and Welfare weekly media briefing revealed the severity of staffing and blood shortages in Idaho hospitals.
If current trends continue, I expect that crisis standards of care will be activated in additional areas of the state.
That our physicians and our staff are completely exhausted.
And staffing challenges are only going to continue to get worse if we don't collectively take action.
St. Alphonsus Dr. Stephen Nemerson says 80% of COVID hospitalizations at St. Alphonsus are unvaccinated people. And amid the most rapid COVID surge yet, Nemerson says his hospital is not equipped to care for the same number of patients they did during the Delta wave. This is largely due to staff catching COVID themselves and having to quarantine. That leaves those same staff members unable to work at the hospital and help patients in need.
We don't have the ability any longer to expand into non-traditional spaces, in part because of lack of staff, in part because of lack of support.
In the past few days, between 117 and 169 staff members are on COVID leave at St. Alphonsus. This is more than the number of supplemental staff St. Alphonsus has received from FEMA and other government aid.
And we're grateful for those resources and desperate for more.
Nemerson says anyone needing medical care is still encouraged to come to the hospital. St. Alphonsus is currently operating under Tier 2, where non-traditional staff is used in order to care for all patients. But that has Nemerson concerned for a potential shift to Tier 3, where care and resources may be rationed. Resources like blood, as the Red Cross says we're amid the largest blood shortage in more than a decade.
That rationing hasn't happened yet. But we're fearful that it will, and that's one of the reasons that we appealed for crisis standards.
The Red Cross tells us this blood shortage is sparked partly by staffing shortages on their end too. If their staff is sick, they can't hold blood drives to collect the blood they need, but also donations have dropped overall 10% since the beginning of the pandemic. So fast forward almost 2 years later, those rates are proving to be unsustainable.
Andrew, this virus is just everywhere right now. It's really heartbreaking that we're back in the same position, overwhelming our healthcare system.
Yep, and it's different this time. It's a different reason for the surge and crisis standards of care.
Yeah, exactly. Andrew Bartline.